Welcome to Vet Fraternity. In this video, we are going to discuss a very important topic, that is corneal ulceration. What does corneal ulceration means? Ulceration, basically it is the loss of corneal epithelium with or without loss of varying amount of underlying corneal epithelium. So basically, in order to understand this definition, we need to understand the anatomy and histopathology of cornea first. That will help us to help us understand the ulcers that form in the cornea. The corneal epithelium, or you can say the cornea, it has multiple layers. The outermost layer is of corneal epithelium. Then we have corneal stroma. Then we have descent membrane, and then we have corneal endothelium. The corneal epithelium is the most superficial layer. As you can see over here, this is the corneal epithelium. It is comprised of 5 to 10 cell layers. Then we have corneal stroma. Stroma occupies 90% of the corneal thickness. So starting from like here, and this all is the stroma. Then it composed mostly of collagen, glycan, and few keratinocytes. These are the cells or substances that are present in the stroma. Then we have the descent membrane, that is the basement membrane. Then we have endothelium, that is the innermost layer. So what they say about definition is loss of corneal epithelium with or without loss of varying amounts of underlying corneal epithelium. So the ulcer will form when the portion of the epithelium will get lost. Now this epithelium can be superficial, or it can be like deep, or like it can breach into the layers of stroma. How much depth, it depends upon. So that loss of epithelium along with or without the loss of varying amounts of underlying layers is called as ulceration. Next we have is types of ulcers. There are 3 common types of ulcers. Number first is simple corneal ulcer, that is called as uncomplicated ulcer. Then we have complex corneal ulcer, that is called as complicated ulcer. Then we have is indolent corneal ulcer, that is called as refractory ulcers. In this video, we will study the simple corneal ulcer, and for the complex and indolent corneal ulcers, we are going to have a separate video lecture. Before starting uncomplicated or superficial ulcer, you need to understand this term, superficial keratitis. Keratitis is called as inflammation of cornea, and it is characterized by vascularization and opacification of the cornea. You can see the blood vessels over here. So this is something that keratitis is characterized of. Also, unilateral keratitis is often secondary to trauma. It's just the definition of keratitis. I just wanted you to know what the superficial keratitis is. Okay. Now from here, we are going to start uncomplicated corneal ulcer. The definition for that is very superficial erosions in which there is only loss of corneal epithelium. So we know this is the corneal epithelium, this is the stroma, then we have the descent membrane, and then we have the endothelial layer. So in uncomplicated corneal ulcer, only the superficial corneal epithelium is being lost, and this epithelium always heal in the 7 days. If you remember the first lecture in which I gave a glimpse of anatomy of the eye, there I told you that the corneal epithelium has its healing time of 7 days, or a turnover rate of 7 days. If it gets damaged, it automatically heals in 7 days. So that loss is basically of the superficial epithelium is called as uncomplicated ulcer. The diagnosis is fluorescein stain. Basically, you apply the green stain on the eye, and what does that happen? That this stain binds to hydrophilic stroma but will not bind to hydrophobic epithelium. So you see, this is a stroma, and the green dye has been attached to this hydrophilic portion, not the hydrophobic epithelium. This all portion is going to be hydrophobic because it is epithelium, and epithelium is hydrophobic. So That's how the stain sticks there, and we diagnose it as ulcer. Like if you see the previous image, you see this whole greenish, this greenishness is basically the stain. The stain has been attached to the stroma, which is hydrophilic, and it has not attached to the epithelium, where the epithelium, like this whole area epithelium is intact. So here no stain has been attached. Next comes the causes of uh, uncomplicated corneal ulcers. There are two major deviants. One is traumatic and the other one is decreased corneal protection. Let's study the traumatic one. Uh, in the traumatic one, we have either exogenous or endogenous sources. Exogenous are like very common with foreign bodies like plant material, cat claw, anything that has been a source for like ulceration or damage to the corneal epithelium is the exogenous traumatic. For endogenous traumatic, usually due to eyelid abnormalities. So eyelid abnormalities we have like atopic cilia, distichiasis, or entropion. These things cause even when we have studied the topic of entropion or atopic cilia, we have studied even there that these abnormal hairs cause damage to the epithelium of the cornea, causing ulcers. Next, we have is decreased corneal production. For decreased corneal production, we have issues like decreased tear production. When tears are less produced, the eye is going to get dry, and there are chances of ulcer formation. Any tear will form and get a crack on the cornea, and that's how ulcer will form. So KCS or decreased tear quality, exposure keratitis or pigmentary keratitis, basically these situations cause the corneal ulceration. Exposure keratitis means that the eye is being exposed to the air for long and there is no lubricant material there, and then the pigmentation start to change when the disease, then when the conditions gets chronic. So that's how basically this situation happens. Next is decreased blink reflex. If the animal is unable to blink either due to leg ophthalmos, we have studied that topic in detail in a separate video, or if there is any cranial nerve 5 or 7 deficit, because these cranial nerves are involved in the blinking reflex of the eye. So because of these, when the blink reflex will be less, eye will remain open, and it is exposed to any foreign body or any issue or like dryness and causing leading to the ulcers. If you can see this diagram over here, what does this mean? This is an eyeball. This is like the cornea. In the cornea, ulcer can be anywhere. If the like it's based on, it's not like much important point, but still you can have a rough guess of the ulcers cause based on this thing. So if the ulcer is formed on this area, that means that most probably it is going to be due to atopic cilia, because cilia is an abnormal hair in the eye. So it will be formed at any area that is above the upper portion of the cornea. If it is due to exposure keratitis or like KCS, the ulcer is going to be formed in the middle area. If it is due to entropion, it is going to be in the lower area. If it is due to any foreign body, because of that, the ulcer will form in this region. So that is one of the like location of ulcers based on the cause behind. Next, we have the clinical signs. First thing you should know that not all clinical signs will appear at once. You might see 2 to 3 clinical signs in some animal, the other 2 to 3 signs in another animal, okay? But we have to remember all of these signs. Number one is blepharospasm, that is abnormal blinking or spasm of the eyelids. Then we have conjunctival hyperemia and large vessels. Then we have third eyelid elevation. Then we have ocular discharge, that is often serous. Then we have corneal edema. Then we have obvious defect in corneal epithelium, like this defect is obvious, very obvious, like with the naked eye. Even this one, even without stain, we can see the defect in the eye. So obvious defects in the corneal epithelium, and plus minus may or may not be meiotic pupils can be seen along with aqueous flare, because corneal ulceration might lead to reflex uveitis. So if the uveitis starts to happen in the same eye, you are going to see aqueous flare and meiotic pupil also. Next is treatment, and treatment is very important to understand. You are going to even if it is like uncomplicated ulcer that is not being complicated by bacteria or anything like that, still you are going to start with broad spectrum antibodies 3 to 4 times a day. You need to remember this frequency for the paper point of view, because when we will see the complicated ulcer, we are going to see that the frequency increases. So the antibiotics that can be used are BNP, bacitracin, neomycin, polymyxin B, terramycin, erythromycin, tobramycin ointment. The second thing is Midriatic cycloplegia like agents like atropine. Why atropine? Because it relieves the pain and spasm, and it increases comfort by dilating the eye, and it reduces the reflex uveitis chance. So atropine is very necessary to relieve the pain and spasm in the eye. Also, you have to avoid atropine if there is underlying KCS or glaucoma going on. If the ulceration is due to KCS, you need to avoid using atropine, because we know atropine causes dry eye in itself, like decreased tear production. So you have to see the underlying cause also. Then e-collar is must. You have to prevent animals from doing self trauma. You can provide systemic analgesia, like per-oral carprofen, opioid, tramadol, or gabapentin can be used, but you are never going to use topical steroid. This is a very, very, very important point. You are never going to use topical steroid because it will start to melt the ulcer, and it will complicate the situation. So steroids in ulcers are contraindicated. Then you have to recheck, like you have to ask the owner to bring back the animal. If brachysphalanx 1 to 2 days, non-brachysphalanx 3 to 5 days. That's how you have to keep on rechecking. Last thing is prognosis. For superficial corneal ulcers carry excellent prognosis, and they should always heal within 5 to 7 days with treatment. That is very, very, very important thing, because if you have treated an ulcer that was superficial and it did not heal in 7 days, then you have to reevaluate. It's not like you have to change the antibiotic. Rather, you have to change your diagnosis. So reevaluate if not healing. That means your diagnosis was wrong, or maybe now the ulcer has been gotten complicated. So just not change the antibiotic, but rather change your diagnosis also, because it is for sure thing for the healing of the ulcer, that in within 5 to 7 days, the 7th day or 7 days are like a benchmark, you can say, the superficial ulcer heals. That was all about uncomplicated ulcer. In the next video, we are going to talk about complicated ulcer. Till then, thank you so much for watching, and don't forget to like, subscribe, and share.